let's talk about some of your treatment options. There's two paths. One I call the degenerative path, and one I call the regenerative path. Now, the degenerative path, that was the one my father-in-law was on, and it's probably the one you're on if you have it. And what that means is, because peripheral neuropathy is almost always progressive, meaning once it starts, it just keeps going, so it's degenerating. On that path, what we do is try to make you comfortable. You take medications like gabapentin or Lyrica. They are anti-seizure medications, but they're effective in numbing pain. What they're not effective in doing is slowing or stopping the rate or the continuance of the peripheral neuropathy. That's why it's degenerating. There is a regenerative path, and that's what's really exciting about being a part of peripheral neuropathy. A treatment is because the body was designed to heal. The parts of the body that are being affected during peripheral neuropathy happen to be parts of the body that are normally quite good at healing. For example, the microvascularization and the sensory nerves. About a week ago, I had a cut on my hand. I don't even remember how I did it, but it bled a little bit. And today, you wouldn't see it at all. There's no evidence of that. But when I cut, I had to have cut the small blood vessels, and I had to have cut through the small sensory nerves. And yet now I can still feel it today because my body was able to regenerate, and your body is able to regenerate. But when you have peripheral neuropathy, the part, your feet, farthest from your heart starts to lose that ability. And what it needs is help. It needs help in getting new oxygen to the tissues, and those nerves need stimulation and help to regrow. And in most cases, it happens quite well. You might also be asking yourself, well, if I do a treatment like this, will it come back? Maybe. But the wonderful thing is we'll give you the education and the equipment that if it starts to come back, you start the treatment again, and you don't wait till it gets so bad. Most of the time, you can sit at home watching TV, sitting on your computer, and doing it. You don't have to eat a ridiculous diet. It is really exciting to know that literally, not only can you improve dramatically, that this can be an issue you don't have to deal with as far as the pain and the symptoms for the rest of your life. You will have what it takes to deal with this ongoing issue.